In this video, I'm going to tell you a very simple remedy for ulcers. But with this remedy, you'll also need to correct your diet. Because if your diet was already right, you wouldn't have developed an ulcer in the first place. Now what? Is an ulcer? An ulcer is not a small disease. It's a dangerous condition. In this, the inner lining of your stomach or small intestine gets ruptured. There's a hole or a crack. If we talk about the causes, one reason is stress, and the other is nutritional deficiencies. What does this mean? It means you're not getting the essential nutrients from your food that prevent ulcers. Then there's a bacterium called H. pylori. It can cause ulcers. I'll talk more about this later. And then there are NSAID's side effects, over-the-counter painkillers like Disprin, etc. These painkillers have many side effects, and stomach ulcers are one of them. The pain from ulcers is terrible. There's a burning sensation, and it wakes you up in the middle of the night. You can't fall asleep again. Because of this, your sleep remains incomplete. And when your sleep is incomplete, your entire next day is ruined. Due to lack of sleep, you can't focus on work. Overall, productivity goes down. Many people start taking antacids or calcium, carbonate tablets, or go for PP, is like Omeprazole. These reduce acid production, but it's only temporary. And the important point is that ulcers actually occur due to low stomach acid. It's not high. These medicines may give temporary relief to the patient, but also come with side effects such as excess gas, vomiting, nausea, headache, stomach pain. If these medicines are used for a long time, they can cause osteoporosis, bone fractures, pneumonia, vitamin C deficiency, and, if used for years, they increase the risk of dementia. Ulcers increase the risk of infection. And again, this is not a permanent fix, so the question arises, apart from these side effects, is there any safe alternative? And is there a natural remedy available? I came across a study in which people with ulcers were divided into two groups. One group was given omeprazole. The other group was given cabbage juice for 2 weeks. The results showed 83% improvement in the group that took cabbage juice, and 81% improvement in the group that took omeprazole. There was only a slight difference in the results, but the cabbage juice group showed better results, perhaps because cabbage has no side effects. Then another group was created. This time, one group was given Cimetidine. Cimetidine is also used to reduce stomach acid. And the other group was given cabbage juice. The ulcers in the cabbage juice group healed in 15 days, while the ulcers in the Cimetidine group took 28 days to heal. So here too, cabbage juice gave better and faster results. Now what's so special about cabbage? In the studies done on this, a vitamin called vitamin U was mentioned. Actually, it's not a real vitamin, it's a group of sulfur compounds. Tiny plant-based chemicals that include sulfur. This group is called glucosinolates. These chemicals inhibit the growth of H. pylori, the bacteria that causes ulcers. They inactivate H. pylori. That's the reason cabbage is so potent and effective in healing ulcers. Now, the question also arises, why does H. pylori enter someone's body in the first place? In my earlier videos, I've mentioned that H. pylori exists in almost every normal person. But it stays inactive not in its pathogenic form. It remains hidden. And when stomach acid levels drop too low, the pH of the stomach becomes high. It becomes more alkaline. Then this microbe, H. pylori, starts to overgrow and turns pathogenic, and then causes ulcers. Normally, the stomach's pH should stay between 1 to 3 anacidic pH. But when stomach acid reduces, pylori starts to grow and becomes dangerous. The big problem is that then you're again prescribed acid-suppressing medications anyway. This is my own point of view, and cabbage apparently helps heal ulcers. Now here are a few important things about cabbage that you must know when you overcook it. The important nutrients and chemical compounds are destroyed, so it's better to eat it in its raw form. You can eat raw cabbage as salad, or you can make cabbage juice and drink it. These days, red cabbage is also available in the market. Both green and red cabbage have the same chemical composition. You can use either one. You can steam cabbage and eat it. You can ferment it at home. Recipes are available online under the name sauerkraut. It's a very good source of probiotics. It's great for gut health. Or you can make pickled cabbage using local methods. So these are 4 ways to include cabbage in your diet. Eat it raw, steam it, ferment it, make juice. There's one more benefit of juice. The phytochemicals in cabbage are found in a more concentrated form in juice. Cabbage doesn't yield a lot of juice, so it's easier to drink in small quantities. Even the pulp left over after juicing can be added to a dish, so it won't go to waste. Try this out. Thank you for watching the video. See you in the next one.